Okay, Dr. Tataridou, the floor is yours.
Good morning, everyone. I'm Eftychia Tataridou, and today I'll be discussing the profound impact of physics and technology used in modern radiotherapy. We will cover the fundamental principles behind radiotherapy and the latest technological innovations, such as advanced imaging and radiation techniques that improve patient outcomes. Physics and technology are essential in radiation therapy. They help us understand how radiation interacts with tissues so we can predict and control it. Advanced tech allows precise targeting of tumors, ensuring effective treatment while protecting healthy tissue. Imaging and planning tools help us minimize damage to healthy areas by focusing radiation only at the tumor site. Physics show how particles like protons deposit most of their energy at the tumor, reducing exposure to healthy tissue. That's the key for particle therapy. Linear energy transfer describes the amount of energy that radiation deposits along its path through tissue. Understanding that is crucial in determining the effectiveness of different radiation types for cancer therapy. Radiation interacts with tissues in different ways, primarily influenced by the type of particle used and their linear energy transfer influenced by the type, like low-lead radiation, includes photons and protons. Low-lead radiation transfers energy more sparsely along its path, which often results in less complex DNA damage that the cell can sometimes repair. This characteristic makes low-lead radiation suitable for certain types of tumors, where minimizing damage to surrounding healthy tissue is a priority. High-lead radiation, such as heavy ions, for example carbon ions, deposit energy much more densely as it travels through tissues. This leads to more complex and clustered DNA damage, making it harder for cancer cells to repair and survive. The choice between low and high lead radiation depends on the tumor type, location, and treatment objectives. So here we can see in this table which are the uncharged and charged particles and which ones has low and high lead. High-lead particles, such as carbon ions, as we said before, are particularly effective for deep-seated or radio-resistant tumors because they create complex DNA damage, as you can see in this photo behind the second part. They are highly effective at killing cancer cells that may not respond as well to low-lead treatments like conventional X-rays or protons. Accurate calculations ensure effective radiation therapy. Physics-based algorithms guide precise delivery to the tumor, minimizing exposure to healthy tissues. This precision is key in shaping the beam to the tumor, especially when it's near vital organs, reducing side effects and complications. Beam shaping and modulation help target tumors precisely while sparing the healthy tissues. Using techniques like IMRT and SBRT, we adjust radiation intensity, ensuring the highest dose is focused on the tumor. This precision minimizes damage to the nearby sensitive tissues, improving the treatment outcomes and reducing significantly the side effects, which are tremendous for the patients. Artificial intelligence is revolutionizing the field of radiotherapy by optimizing various aspects of treatment planning and delivery. Let's look at its key contributions. It optimizes treatment planning. AI algorithms automate complex processes like tumor contouring and dose optimization. By rapidly analyzing imaging data, AI can identify tumor boundaries with high accuracy, allowing for precise dose calculations and reduce the time required for planning. It enhances personalized treatment. AI leverages large databases, including patient-specific data and treatment outcomes, to develop personalized radiotherapy strategies. By analyzing this data, AI can predict the most effective treatment approaches for individual patients. And lastly, supports real-time adaptive radiotherapy. AI enables real-time monitoring and adaptation during treatment. AI is increasingly integrated into treatment planning and radiotherapy, bringing efficiency and precision to the process. Automates tumor contouring, as we said before. It reduces the time needed for planning and improves accuracy. Optimizes dose calculation and saves time while increasing this accuracy. It analyzes large data sets to personalize treatment, improving precision and reducing the side effects. plays a crucial role in predicting treatment outcomes, enabling a more personalized approach to the cancer therapy. It utilizes advanced machine learning algorithms to predict how tumors will respond to specific treatment protocols. By analyzing vast amounts of clinical and imaging data, this model can identify patterns and predict the likelihood of tumor shrinkage or control, helping and make informed decisions. AI integrates individual patient characteristics such as genetic information, imaging findings, and prior treatment responses. In adaptive radiotherapy, adjust treatment daily, ensuring precision despite patient movement or tumor changes. Modern radiotherapy is continuously evolving, incorporating cutting-edge technologies designed to increase precision, effectiveness, and patient safety. Let's briefly go through some of these advancements. Flash therapy is a groundbreaking approach in radiotherapy that delivers radiation at ultra-high dose rates, far exceeding those used in conventional treatments. Flash therapy administers doses exceeding 40 gray per second compared to the typical 0.1 gray per second in the standard radiotherapy. This rapid delivery is designed to maximize tumor control while minimizing the duration of exposure. One of the most promising aspects of flash therapy is its potential to reduce damage to the normal tissues. The hypothesis suggests that the ultra-high dose rates deplete oxygen levels in normal cells, creating a protective effect that reduces toxicity, a phenomenon not seen with conventional dose rates. With radiation delivered in milliseconds, flash therapy has the potential to significantly shorten treatment times. This could open up the possibility for a single-session treatment, enhancing patient convenience and compliance. As of now, flash therapy is in preclinical and early clinical trial phases. Ongoing research is focused on facilitating its therapeutic effectiveness and safety profile to determine its suitability for widespread clinical use. Next one is the MRI-guided linear accelerator system. It represents a significant advancements in precision radiotherapy by combining real-time imaging with radiation delivery. This system utilizes continuous MRI guidance, allowing clinicians to visualize tumors and surrounding soft tissues in real time. It provides precise imaging of the anatomy, which is crucial for accurately targeting tumors, especially those located in complex or mobile regions. The integration of MRI enables adaptive radiotherapy. This allows for on-the-fly adjustments of treatment plans based on daily anatomical changes, such as tumor shrinkage or patient's movement, ensuring that the radiation remains focused on the tumor throughout the treatment course. By combining a 1.5 Tesla MRI with a linear accelerator, this system achieves simultaneous imaging and radiation delivery. This integration is particularly beneficial for moving tumors, such as those affected by breathing, as it improves accuracy and precision during treatment. This technology is especially advantageous for treating tumors in the abdominal, pelvic, and thoracic regions, where organ motion presents a challenge. Next one is the biology-guided radiotherapy. It's an advanced approach that incorporates biological information to guide and adapt radiation therapy. Let's explore its main components. PET-guided real-time adaptation uses PET imaging to monitor the metabolic activity of tumors in real time. By tracking biological processes such as glucose metabolism, it provides a functional basis for targeting the radiation more accurately. This method allows for tumor heterogeneity targeting, where radiation is delivered based on functional information, enabling techniques like dose bending. One of the key features is its ability to modify treatment in response to real-time biological changes observed during radiation sessions. This adaptability ensures that the therapy remains effective as the tumor evolves, increasing the precision and success rate of treatment. Then we have the proton therapy, which is an advanced form of radiotherapy. It uses protons instead of X-rays to treat cancer. Let's discuss the features. Protons have a distinct advantage over conventional radiation because of the Bragg peak effect. They deposit the maximum energy at a specific depth, minimizing the exit dose and sparing the normal tissues beyond the tumor. This precise energy delivery is especially valuable for tumors located near critical structures. The focused energy deposition allows for higher doses to be delivered directly to the tumor while reduced collateral damage. This is particularly important for pediatric cases and tumors in sensitive regions where protecting adjacent healthy tissues is crucial. Proton therapy is frequently used for treating challenging and deep-seated tumors, such as skull-based tumors, pediatric cases, and spinal tumors, where accuracy is paramount. Its ability to target these areas with minimal impact on surrounding tissues makes it a preferred choice for complex cases. Proton flash therapy is an emerging approach that integrates the precision of proton therapy with the ultra-high dose rates characteristic of flash therapy. This technique combines proton therapy's accuracy with the ultra-high dose rates of flash therapy exceeding 40 gray per second. The goal is to maximize tumor control while minimizing damage to surrounding healthy tissues. One of the hypotheses behind proton flash therapy is its potential protective effect on normal tissues. At such high dose rates, the technique may reduce the oxygen effect in the normal cells, leading to less toxicity while still achieving high levels of tumor cell kill. Early preclinical studies have shown promise in reducing both acute and chronic toxicity associated with traditional radiation therapy. By delivering radiation in milliseconds, proton flash therapy has the potential to minimize the side effects, enhancing patient quality of life during and after treatment. Currently, though, proton flash therapy is in the early stages of clinical trials. Researchers are focused on validating its therapeutic efficacy and exploring how it may improve treatment outcomes over conventional proton therapy. Then we have the synthetic CT from MRI, which is an innovative approach that integrates MRI imaging into radiation therapy planning. This technique converts MRI scans into synthetic CT images, allowing accurate dose calculations without the need for additional CT scans. It supports MRI-only workflows, streamlining the planning process and reducing patient exposure to multiple imaging modalities. MRI provides superior soft tissue contrast compared to the conventional CT. This advantage improves tumor delineation, especially for cancers where soft tissue differentiation is critical, ensuring more precise treatment planning. One significant benefit of using a synthetic CT from MRI is the elimination of ionizing radiation associated with traditional CT scans. This reduces cumulative radiation exposure for patients, particularly beneficial during repeated imaging required in treatment planning and adaptation. Synthetic CT from MRI is particularly advantageous for head and neck, brain, and prostate cancers. As we look towards the future of radiotherapy, the field is rapidly evolving with promising technologies and techniques aimed at increasing precision, reducing side effects, and improving patient outcomes. Here's what we can anticipate. Hadron therapy. Particularly using carbon ions is an advanced form of radiotherapy that offers unique benefits for challenging cancer types. Carbon ion therapy utilizes particles with high linear energy transfer. These ions induce complex DNA damage in cancer cells, which is often beyond the repair capacity of radioresistant tumors. This makes carbon ions therapy highly effective for tumors that are less responsive to conventional radiation. Carbon ions have a higher RBE compared to photons or protons, meaning they are more effective at killing cancer cells per unit of dose delivered. This is particularly advantageous for deep-seated or hard-to-treat cancers, such as sarcomas and pancreatic cancers, where conventional therapies may fall short. Hadron therapy offers enhanced precision in energy deposition at tumor sites. The physical properties of carbon ions allow for precise energy release directly at the tumor location, minimizing damage to surrounding healthy tissues and enhancing the overall therapeutic effect. Adaptive approaches in radiation therapy adjust treatment based on real-time changes in the tumor or organs. Techniques like 4D imaging and gating help account for motion, while machine learning personalizes treatment plans, improving outcomes and protecting the healthy tissues. As we mentioned already about flash therapy, combines proton treatment with ultra-high dose rates, reducing normal tissue damage. It shows promise in sparing normal tissues while treating resistant tumors, and is currently under clinical investigation with positive early results. While advanced radiotherapy techniques offer significant benefits, there are several challenges and limitations that need to be addressed. Let's review them. Cost and accessibility. The high cost associated with building and maintaining equipment such as proton centers and heavy ion facilities are a major barrier. These technologies require substantial financial investment, which limits their accessibility and particularly in low-resource settings. Additionally, the availability of those advanced technologies is limited globally, making it difficult for many patients to access the most cutting-edge treatments. Proton therapy faces challenges like proton rates uncertainties, which affect the precision of energy deposition in the tumor. As technology evolves, adaptive solutions are needed to overcome these limitations. For MRI-guided radiotherapy, MRI metallic artifacts can interfere with imaging quality, complicating treatment planning and delivery. Addressing these artifacts is critical for improving the accuracy and reliability of MRI-guided treatments. Many of the newer techniques, such as the flash therapy, are still in early stages of clinical testing, as we said before. To validate their effectiveness and safety, more clinical trials and long-term outcomes data are needed. There are several ongoing clinical trials aimed at advancing radiotherapy techniques. These are currently in phase 1 and 2 trials exploring the safety, optimal dosing, and therapeutic efficacy of delivering ultra-high dose rates. The goal is to establish protocols that maximize tumor control while minimizing the side effects. Trials are focusing on the application of heavy ions like carbon ions for treating radioresistant tumors. These studies aim to validate their effectiveness in challenging cancers such as sarcomas and pancreatic cancers. AI is becoming integral to radiotherapy, with several key developments underway. AI-driven algorithms are being developed to optimize treatment plans in real time, adjusting radiation delivery based on daily imaging and tumor changes. These advancements aim to enhance precision and effectiveness. Building on the role of AI in predicting outcomes, radiogenomics integrates genetic markers into treatment planning. By analyzing a patient's genetic profile, we can tailor radiation doses more precisely, enhancing the effectiveness of the therapy while minimizing the side effects. To conclude, AI, physics, and technology are advancing precision in radiation therapy. Innovations like flash, MRI, guided RT, and personalized treatments are shaping the future. Ongoing research and collaboration, though, will be crucial to achieving these breakthroughs. Thank you for your attention.